Reversing diabetes is a term that usually refers to a significant long-term improvement in insulin sensitivity in people with type 2 diabetes. People with type 2 diabetes that are able to get their HbA1c below 42 mmol/mol, 6%, without taking diabetes medication are said to have reversed or resolved their diabetes. This also known as putting diabetes into remission. But before that, consider subscribing, click the notification bell and hit the bell button to be updated for latest natural way remedy uploads. Loss of body weight can be particularly beneficial in helping to reverse the progression of diabetes. With time and dedication, type 2 diabetes can be reversed and the results can be very rewarding, with less tiredness and better all-round health. Understanding how diabetes progresses. The most common cause of type 2 diabetes is obesity-related, which generally follows a vicious cycle pattern. Diet high in calories, particularly if high in refined carbohydrates. Insulin levels in the bloodstream rise to cope with the high and quick-acting carb intake. Weight is gained around the belly, central or truncal obesity. Consistently high insulin levels lead to the body's cells becoming resistant to insulin and commonly lead to weight gain. High insulin levels also increase weight gain. Insulin resistance leads to an increase in blood sugar levels, particularly after meals. The pancreas produces more insulin to cope with rising blood sugar levels. High sugar levels lead to feelings of lethargy and high insulin levels lead to increased hunger. Hunger often leads to overeating and lethargy, with less physical activity being taken. Overeating, less activity and high insulin levels all led to further weight gain and more insulin resistance. Consistently high demand on the pancreas to produce extra insulin leads to damage of the pancreas' insulin-producing beta cells. Beta cell damage results in the body struggling to produce enough insulin, and steeper rises in blood sugar levels leads to more recognizable symptoms of diabetes. Symptoms of diabetes, such as thirst and a frequent need to urinate. Breaking the progressive cycle of type 2 diabetes. To reverse diabetes, you need to be able to break this cycle by taking the strain off your insulin-producing cells. Research indicates that effective ways to reverse diabetes include low-carbohydrate diets, very low-calorie diets, exercise, bariatric surgery. Low-carbohydrate diets. Low-carbohydrate diets are known for lowering the amount of insulin the body needs to produce, resulting in less insulin resistance. A study published in 2014 by the Second University of Naples showed that a low-carbohydrate Mediterranean diet was able to achieve significant rates of remission in people with type 2 diabetes. After 1 year of following the diet, 15% of participants achieved remission and, after 6 years, 5% had achieved remission on the diet, a stunning achievement. By comparison, low-fat diets were not as effective in the study. After 1 year, 4% of participants on a low-fat diet had achieved remission and, after 6 years, 0% of participants had achieved remission. Very low-calorie diets have been shown to achieve significant weight loss, reduce insulin resistance and allow people with type 2 diabetes to come off their diabetes medication. A VLCD is regarded as an extreme form of diet and therefore should be undertaken with care. If you are interested in following a VLCD, it is important that you first speak with your doctor to ensure the diet is safe for you to follow. In addition to the results seen in clinical trials, a number of anecdotal reports from patients show VLCDs to be successful at reversing diabetes to varying degrees. Exercise. Commitment to exercise has allowed a number of people to successfully reverse their type 2 diabetes. Exercise helps the body to become more sensitive to its insulin. In combination with a healthy diet, exercise can reduce the demand for insulin in the body and therefore help reverse diabetes. There is a phrase that says, "You can't outrun a bad diet," and there is a lot of truth in this. The people that have used exercise to reverse their diabetes have done so by combining exercise with healthy eating. There have been a number of anecdotal accounts showing exercise to be linked with diabetes remission. A study published in 2015 showed that 67% of participants were able to achieve partial remission of their type 2 diabetes having taken part in a 6-month diet and exercise program. The participants in this study were newly diagnosed with type 2 diabetes. Bariatric surgery. Bariatric surgery has shown significant results in reversing type 2 diabetes, with gastric bypass surgery leading to particularly impressive remission rates. A 2010 study showed that 3 years after gastric bypass surgery, 72% of participants with type 2 diabetes had achieved remission, and a 2013 study reported that 24% of participants with type 2 achieved remission 6 years after receiving gastric bypass surgery. Gastric bypass surgery delivers the most impressive long-term remission rates but carries a risk of complications during and following surgery. It is a permanent procedure and necessitates a change to how you eat meals. During gastric bypass surgery, the stomach is made much smaller, and only small meals can be eaten following surgery. Additionally, nutritional supplements will need to be taken for the rest of one's life.